So in the Coachella Valley in California, we have formed partnerships with the mayor of Palm Springs, who has raised money for a local seed fund for 45 bold action steps that they collectively are working on.
So last year, we really expanded our Race and Wellness Festival. We actually raised a little over $400,000, which went directly to programs identified in the Blueprint for Action with the Clinton Health Matters Initiative. This year we'll net almost $500,000. Net $500,000 will go to fund bold steps in the Clinton Health Matters Initiative Blueprint for Action for the Coachella Valley. So it's very exciting.
We've seen local businesses come to the table and identify what they're going to do to improve the health of their employees, whether it be forming walking groups and adding benefits to their portfolio or instituting employer wellness incentives.
When you think about Houston, it's one of the biggest cities in the U.S. It also has some of the best health care in the U.S., yet it doesn't have the best stats as it relates to health.
If more companies were as active in this space as GE is active in places like Houston or Cincinnati, healthcare reform could spread and accelerate.
GE really tries to work on problems that matter. Without health, you actually have nothing at your individual level.
We work to bring more coordinated care to our employees and their families. And what we've seen is for employees that have diabetes, children with asthma, that we've been able to bring down the cost of care, but also improve the quality of care. That's an effort we believe we can bring to a place like Houston, Texas.
So when you look at the city of Houston, what's really interesting is that in a sense, Houston is a snapshot of the future of America. When we look at what's happening, especially with our children, you have the makings of problems with some of those kids really reaching their full potential.
I think when you talk about preventive health, there's sort of two camps that I think about. Lifestyle changes that you can make to prevent the onset of disease, and then the other camp is preventive screenings so that you can catch disease early, treat it so that you don't suffer the consequences.
Now you don't have to wait for the government to do something about it. Now the private sector is taking a lead.
What's really exciting is that the traction is happening across sectors. We're getting engagement from business as well as the NGO community.
Imagine being able to find some solutions from that now you can start to scale. You have two partners who are committed to this area that want to take these outcomes, these types of solutions, to other places to actually be able to scale them up.